Hello, everyone. I'm Lindsay Joseph, the Links Program Officer, and I would like to welcome you to the June Links webinar. The presentation will be 35 minutes long, followed by a Q&A session. We encourage all participants to use a Q&A button to ask questions. The Q&A button is located at the bottom of your screen. Again, we prefer the Q&A button as opposed to using the chat feature for this webinar. The webinar is being recorded and will be posted to linkscommunity.org following the session. I will now hand it over to Lindsay Steele, Senior Program Officer for Nutrition Policy, to introduce the topic and speakers for today's webinar.
Welcome to today's Links webinar. Resolve to Save Lives is an initiative that aims to save 100 million lives by partnering with countries around the world around 3 different programs: elimination of artificial trans fats, sodium reduction, and improved treatment of hypertension. Links is an online community and resource center for people working to improve cardiovascular health around the world, developed in collaboration between Resolve to Save Lives, World Health Organization, and the Centers for Disease Control and Prevention. 500,000 people die each year because of trans fat in their food. That's 1 person every minute. Replacing trans fats with healthier oils is possible and will save 17 million lives from heart attacks in the next 25 years after successful global elimination. Last year, WHO launched the Replace Action Package to eliminate artificial trans fats from the global food supply by 2023. While several countries have taken steps to reduce or eliminate artificial trans fats, progress has been largely limited to high-income and Western countries. Resolve to Save Lives has partnered with WHO and the Global Health Advocacy Incubator, or GHAI, on this effort and is supporting countries to implement regulations to enact the proven strategies of Replace. GHAI works to advance public health policies to improve health outcomes around the world. GHAI is a proven thought leader in advocacy work and sustainable efforts in low and middle income countries around the globe in various policy areas such as road safety, obesity prevention, and cardiovascular health, among others, providing leadership, guidance, and training to partners at both the country and global level. Today's presenters are Yolanda Richardson, Kira Barassi, and Gianella Severini on behalf of GHAI. Yolanda is Executive Vice President of Global Programs for the Campaign for Tobacco-Free Kids and oversees the programs of GHAI. Kira is Legal Advisor at GHAI, providing technical legal assistance across the organization's nutrition policy programs and on preventing violence against women. Gianella is a lawyer and journalist who works as a legal consultant with GHAI and Campaign for Tobacco-Free Kids across the organization's nutrition policy programs. Our speakers will discuss the legal and policy considerations of trans fat elimination. I will now hand it over to Yolanda Richardson.
Hi, thank you, Lindsay. It's a pleasure to be here with you to talk about the work of GHI and of the initiative of RTSL related to the policy and regulatory considerations for trans fat regulation. So just a brief introduction to the Global Health Advocacy Incubator. Next slide. Next. The Global Health Advocacy Incubator is a program of the Campaign for Tobacco-Free Kids and works on policy issues that relate to trying to improve the lives of people from non-communicable diseases. As Linda indicated, that's across a number of issue areas. We bring about 20 years of experience to the issue of global health advocacy and have worked in more than 50 countries around the world. For the RTSL initiative, we work across both the Preventing Epidemics and the Cardiovascular Health programs, working on policy solutions to support the aims of the program. Next. Just briefly to introduce you a little bit to sort of our approach to thinking about advocacy, there's sort of 4 pieces of work that we go through as we help to support local organizations to advocate for health policies at the country level. Our approach is very much grounded in the notion of helping to build demand from civil society to have government improve its policy response to global health issues. At the very first part of the quadrant, you'll see assess, and this really is, I think, a among the most important, because we spend a great deal of time at the beginning of launching a campaign and really making sure we understand context, legal environment, political environment, NGO capacity, so that we're making the best calculations about how to design and implement a policy campaign. The number two is that we plan that all out, again, getting the best intelligence we can on the ground, working with local partners to make sure that we have policy solutions and a campaign that will be successful. And then we move forward in implementing that campaign. After the campaign is, a policy is passed, we often also do work to advocate to make sure that the policies are implemented well. Excuse me. And we do that across many issue areas, including our biggest programs, which are in tobacco. And then the last piece of it is to begin to support government to be more effective in implementing the work. As I said, the first quadrant is around assess, and that's where we really do the in-depth legal analysis, which undergirds the work that Kira is going to describe just shortly with you. So I'll hand it over to Kira.
Great, thanks, Yolanda. Next slide, please. Next. So this is Kira Barassi with the Incubator, and as Yolanda mentioned, GHAI conducts legal analyses to inform our policy advocacy work, including on trans fat. And at the outset of our work on trans fat elimination, GHAI did an initial scoping in 10 countries to inform our policy advocacy work. Our global perspective is based on these legal analyses, along with our analysis of other countries' existing trans fat policies. We've used this information to build a framework for choosing between the recommended policy options and designing a policy that's tailored to each country, which I'll outline today. And just one note about terminology: policy can mean different things in various contexts. So for the purposes of this presentation, I'm referring to mandatory legal instruments, such as laws, regulations, or compulsory standards. Next. And then next slide. When first considering a trans fat policy, conducting a legal review is important to help you assess whether trans fat has been addressed through any laws or regulations in your country already. And if so, to know what ways it has been addressed and via what regulatory pathways. In many countries, trans fat has been addressed in some way before, such as through labeling or restrictions in infant foods. Understanding how effectively any existing laws are working can help you to avoid repeating any mistakes from the past. For example, if you determine that such laws are not being enforced, you can assess whether this is due to factors such as resource constraints, whether the appropriate agencies do not have the right equipment or personnel, lack of interagency cooperation, or other factors. Also, an assessment of existing laws can allow you to take advantage of and build from existing systems that you find are working well. Next. When conducting a legal review, it is also important to assess existing regulatory authority. This involves identifying which existing legislative or regulatory instruments would need to be amended to allow for trans fat regulation, or if new legislation or regulations are needed. You should determine whether there is a list of banned ingredients or additives to which partially hydrogenated oil could be added. And I'll explain the two policy options in a few minutes to make it clearer in case people are wondering why I'm talking about PHO right now. Also, you want to identify whether there is existing authority for any national ministry or agency to regulate, monitor, and enforce trans fat measures. If not, identify which existing agency needs to be given relevant authorities. And these could be things like the authority to set permissible limits or test products for compliance, to enter and inspect facilities, and more. It will depend on how you craft your policy. Next. And while you're conducting your initial review, there are also impacts from international trade law to consider. And these international trade law considerations are really significant for some other food and nutrition policies. So people working on these issues might be used to international trade law being a really prominent issue. However, for trans fat, we don't think it will be very problematic. We haven't seen any threats of challenges in World Trade Organization committees so far. So we should track these issues, keep them in the back of our minds, just in case. So for example, we should monitor whether there are any developments at the Codex Alimentarius. There's nothing significant as of now, but a codex development regarding trans fat could be significant, and GHAI will continue tracking this issue. And on the slide, I just put a few other issues that people can keep in mind as they're pursuing this work. Next slide. So after those initial 10 legal analyses that the incubator did, we had a number of observations. First one is, in many countries, we found that laws empowering agencies to regulate trans fat through secondary instruments already exist. And by secondary instruments, I mean non-legislation. So these are things like regulations or compulsory standards. And this means that additional law reform may not be necessary. So pursuing a trans fat measure can be more of an expedited process. Also, many countries already regulate trans fat in some way, for example, through labeling requirements or restrictions on trans fat or PHO in infant foods. And as I was discussing before, this allows us to investigate how well these measures are working and if we should use similar frameworks for a new policy. Additionally, multiple potential regulatory pathways are often available for trans fat measures. This allows countries to be strategic and consider things like institutional capacity, timing and processes, industry interference, and political will. So it's always nice to have options. And in some countries, we identify that there are some pending bills or proposed regulations related to trans fat, or TFA was included as part of a national health or NCD policy. And this tells us that there may already be varying levels of awareness and political will to regulate trans fat. So that's something that can be built upon when looking to pursue either a trans fat limit or PHO ban. Next. And then when we're considering the policy options that are recommended by the World Health Organization for regulating trans fat, there are two key options that are outlined in the Replace Action package and are described in detail in the L module. And the first is a TFA limit. And when we say TFA limit, what we mean for it to be the best practice is a limit on trans fat to 2% of total fat in all fats, oils, and foods. The second option is a PHO ban, and that's the ban on the production and use of partially hydrogenated oil. And these two policies share an identical goal. They're both designed to eliminate industrially produced trans fat from the food supply. So neither is inherently stronger than the other. It's really a question of which is the best fit for a country's regulatory system and national food supply chain. Next slide. And so before I get into some country examples, I wanted to just lay out some of the key differences that we've identified between these two policies in terms of their pros, cons, and when they work well. So first, for a trans fat limit, one pro of this policy is that you can test for trans fat. You can test the levels of fatty acids in foods to determine if trans fat is over 2% of total fat. And because you can do that testing, you can easily target many levels in the food supply chain if needed. So if you're not able to trace products high in trans fat to the top of the food supply chain, then you have more levels where you can do monitoring and enforcement. And some countries already have trans fat limits for other policies, such as thresholds for labeling requirements for trans fat to kick in. Some cons of a TFA limit is that you need the capacity to do that testing that I was describing. You can also use reliable and mandatory labeling if you have limited testing capacity, but you likely need at least some capacity to test to ensure that that labeling is indeed reliable. Another con is that with a TFA limit, you're likely regulating farther down the food supply chain, which just means you could be dealing with a greater number of products or sources, and that could just involve more testing, so it could be a greater regulatory burden. There's also a small possibility that some populations could be left vulnerable to consuming dangerous levels of trans fat. And this is because some populations could potentially be consuming a very high fat diet. And so even if each product that they're consuming is capped at 2% trans fat, in aggregate, that could still potentially be a dangerous level of trans fat. And so in sum, a TFA limit works well when the major source of trans fat is PHO from many different producers or informal markets, which make it difficult to regulate at the top of the food supply chain, or if you're dealing with a lot of imported packaged products as being a major source of trans fat. And that's because, again, you'd need to be able to do some testing, since you can't necessarily trace those products back to the top of the food supply chain where PHO was first added to those products. And also we found that PHO is often not labeled consistently in a lot of countries. So sometimes you'll see things like hydrogenated oil being listed as an ingredient, but you don't know then if that's partially hydrogenated oil, which would be high in trans fat, or if it would be fully hydrogenated oil, which would not be. And so then turning to PHO bans, here I'll start with the cons, since it's sort of the flip of the trans fat pros. And that's where you cannot test for PHO. It's an ingredient. And so that means it can be more difficult to enforce this policy, particularly if you're in an environment where there are many PHO producers, informal markets, or those imported packaged products. But on the flip side, with a PHO ban, this policy targets the top of the food supply chain. So if you're in an environment where this ban makes sense, then it can be very streamlined regulatory process in terms of monitoring and enforcing. So less of a regulatory burden. And also, some countries have a streamlined process for enacting a PHO ban. So some countries have things like a list of dangerous or impermissible additives, and PHO can simply be added to that list, which sometimes is much more, it's quicker and easier than other forms of regulation. And so a PHO ban works well when you can identify a few PHO producers at the top of the food supply chain, and when imported packaged goods are not a major source of trans fat. Next. So I'm going to briefly walk through some policy examples and lessons learned from around the world. Next. So starting with Denmark, Denmark was the first country to pass a law to limit trans fat. And we have clear information about how and why the policy was developed and its impact. The policy is a 2% limit on industrially produced trans fat in all fats, oils, and foods. And the law was written to apply to foods sold directly to consumers only. And this formulation has not been an issue in Denmark, but similar language has been used in some other countries' policies where it has caused problems in some circumstances. And I'm just raising this because this will foreshadow some of what Janella will describe in terms of her Argentina case study. And in Denmark, there was an extensive process to develop the policy. The country began monitoring trans fat in the food supply a decade before the law was passed. And one significant finding was that the national average levels of trans fat intake were not particularly alarming. But when you looked at different subgroups, some individuals were consuming much more trans fat than the national average. And that was very compelling to the government, and a rationale that they raised for moving forward with their trans fat policy. And with Denmark, we can see how this policy, which was not particularly challenging to enact, it was quite a streamlined process, has a tremendous impact. So since the law was implemented in 2004, 700 lives have been saved every single year as a result of this 2% limit on trans fat. Denmark is different than other countries in some regards to its ability to test, its testing capacity, and its resources for monitoring and enforcement. But really the lessons that we have from this, from Denmark, help us see that there are ways that we can tailor these policies to work for other countries. So next slide. In terms of trans fat limits, I'm going to skip Argentina because Janella will discuss this in detail. So I'll move to Slovenia, which has a recently enacted policy which limits trans fat to 2% in all fats, oils, and foods. And this TFA limit was a good fit for the country because it was facing an issue with lots of high TFA imports. And this started occurring as other European countries passed trans fat limits. And so exporters were increasingly looking for markets to send these high trans fat foods because they weren't able to send them to some countries that they had previously. And so more and more of these products were being exported to Slovenia. And so as you may recall from that pros and cons slide that I showed previously, a 2% limit can be a great fit for countries that import foods, lots of packaged foods with trans fat, because you can do that testing. And so Slovenia is an example of how countries can become vulnerable to importing products that are high in trans fat as other countries impose restrictions, which is a reason why some countries that may not currently have high levels of trans fat in their food supply may want to regulate it as a preventative measure or to prevent the issue of trans fat from becoming worse. And moving to South Africa, this policy dates back to 2011, but it's actually unclear at this time if it is being effective. There was no baseline data back when the law was designed, and so that's really been a barrier to tracking the efficacy of the policy. And then for the EU, this was a recently enacted regulation that will apply directly to all member states. So it'll be really interesting to track how this law or this regulation is implemented across the member states. And for both Slovenia and EU, the policies take different approaches to language about foods that are not intended for the final consumer. And so after Gianella's presentation, if people have some questions about this language, we can turn back to these countries. Next slide. So for some examples of PHO bans, Thailand is a great example of how this policy can be a good fit for a country. And that's because Thailand identified that there were only 3 domestic PHO producers, which were the primary source of trans fat in the country. For imports, Thailand has a certification process already in place, and they are now using that process for the PHO ban. And this policy was designed as a preventative measure because trans fat was not a primary concern in Thailand. Saturated fat is actually a much greater issue. But that was accounted for in how Thailand designed their PHO ban, because they had a complementary ban on trans fat-free claims being added to products on their labels. And this prevents a so-called health halo effect from being added to products that are high in saturated fat and therefore unhealthy. And so I think Thailand is a great example of how if you know that there are other unhealthy fats in the food supply chain, you can account for those in how you design your trans fat measure. For the US and Canada, for both of them, a PHO ban was a good fit because they had a streamlined regulatory process for this type of policy. So this is what I described before, where for some countries, there might be a list of ingredients that PHO can be added to, and these are ingredients that are deemed dangerous and cannot be added to food, or a list of permissible foods which PHO can be taken off of. And for both the US and Canada, there's a lot of domestic production, which means that a PHO ban is a good fit because you're not dealing with a lot of imported foods. And in Canada, there was potentially, as a factor for this policy, an issue where there could be some subpopulations that consume very high fat diets. And so they could be vulnerable to the 2% limit of trans fat, leaving these populations exposed potentially to unhealthy levels of trans fat. Next. And so now I'm going to briefly summarize a series of 6 questions that can help determine which type of policy would be most effective for a country and key factors for exploring a policy and tailoring it to each country's unique circumstances. Next. So the first question is there trans fat in the food supply? And this question, I think, can make us think about that South Africa example, where there just wasn't that baseline data at the outset, and that continued to cause issues as we move forward in not knowing if the policy is having an impact. And answering this question can also help you build an evidence base in case of a legal challenge down the line. Next. Second, what are the sources of trans fat? Here I think Thailand is one example where we can think about how the country used a PHO ban, which was a great fit because they identified that there were 3 domestic producers of PHO, which contributed most trans fat into the food supply. A counterexample could be Slovenia, and there they found that a primary issue with trans fat was imported packaged goods from other European countries, which meant that a 2% limit on trans fat could be a great fit. Next slide. Third, are there disparities in trans fat consumption across the population? This is something that has been identified in many countries where there are some groups that consume much higher amounts of trans fat than the population at large. So if you look at the national average, it will actually mask the individuals who are most at risk from high trans fat consumption. And so this was something that was considered as a potential issue in Canada, and it was also an example from Denmark. And in Denmark, we've heard that it was the concern for these subgroups of people that was really the basis of the government's decision to take action on trans fat. And so it's important to ensure that a trans fat policy is designed to ensure that all groups are protected. And this can raise some really compelling equity considerations. Next slide. Fourth, what are the likely replacements for PHO? Here I will recall the Thailand example again, because there they had identified that saturated fat is a large concern and even greater than trans fat was. And so by knowing that saturated fats could be a likely replacement for PHO and were already an issue in the food supply, then they could design their trans fat measure as a preventative measure and frame it that way. And they could also use complementary policies to ensure that other unhealthy fats weren't used to replace PHO. And these types of complementary policies can be things such as incentives for healthy fats, front of package labels for saturated fat, as well as things like limiting the use of TFA-free claims. Next. The fifth question is, are there any existing policies regarding trans fat? And this really refers back to what I was talking about at the outset, where in doing your legal analysis, there's really valuable information to seeing whether there are any existing policies, such as labeling requirements or restrictions of TFA or PHO in infant foods or in schools. Because there's a lot that you can learn from those policies that can inform your development of either a trans fat limit or PHO ban. Next. And finally, the sixth question is there TFA testing capacity? In most countries, it will be possible to integrate TFA implementation and enforcement mechanisms into the current food safety regulatory system. But by answering this question of whether there's the ability to test for TFA, if that capacity exists, this will help inform the issues of which policy would be easier and more effective under the existing frameworks and which agencies need to be given appropriate authorities in the policy. And when it comes to relying on labeling, labeling can be helpful and it can inform monitoring and enforcement. But again, we've seen that it's still likely that at least some trans fat testing capacity is necessary to ensure that that labeling is reliable. Next slide. And so a few key takeaways are first that in many countries, regulatory agencies are already empowered to limit trans fat or ban PHO. And this means that developing these policies can be a relatively straightforward process. Also, existing trans fat policies offer important lessons for how to design effective measures. And finally, policy choice and design should be tailored to each country's regulatory system and food supply chain. So now I'll turn things over to Janella. Thanks.
Thank you, Kira. Hi, everybody. This is Gianera. And the idea now is, after the work that Kira presented, to introduce to you all more information about Argentina's regulation, since there are some lessons that can be learned for other countries. And first of all, it is really essential to recognize the effort that Argentina had, because it was a pioneer and it served as a model for the region and the world, and also the good commitment that it had to monitor the compliance. And so, as regards the regulatory framework in Argentina, in 2010, Argentina passed a mandatory TFA limit. It is important to note that it is not the current WHO best practice. The limit is 2% of total fats in vegetable oils and margarines, and then 5% of total fats for other foods. And here it is really important to note that these limits are applying to foods that are intended for direct consumption. And then I'm going to explain a little bit more of the issue that we had with this language. The policy at that time was modeled off the PAHO strategy, and also the voluntary policy that Canada had at that time. And it also mimics the language that is used by Denmark. And as Kira mentioned, this phrase was not an issue in Denmark, but as we're going to see now in the next slides, in Argentina, it has been a little bit problematic, and we're going to explain why it was that. And I think that is really important to note here is that the industry played a really important role to identify which was the good alternative at that time. There was a joint effort between the Ministry of Health, the industry, and also the academia and the civil society to identify which was the best policy for Argentina. This is important to note because the industry is now trying to keep that seat at the table when the government is considering other nutrition policies. And so it is important to note this here because it is essential to establish safeguards against possible conflicts of interest that could arise if the industry is always present during these discussions. The next slide, please. So here we have the article that regulates the TFA in Argentina, but it's really important to note which was the interpretation of the current law that we have here. The monitoring and enforcement is carried by the National Institute of Food, that is called the INAL, and this organization is coordinating at a federal level all the monitoring of the country together with agencies that are at a local level. Argentina has a federal system, and this is why there is a federal organization that is coordinating the monitoring with the local level. When applying this regulation, the National Institute of Food interpreted that this limit for fats and oils only applied to products that are directly sold to the consumer, rather than products that are sold as ingredients to be used, for example, by bakeries or restaurants. So it is really important to note here that the TFA limit has not been applied to raw materials, such as, for example, margarines that are used by bakeries or restaurants or hotels. The limits have been applied to the products that are directly sold to the consumer, such as a product that you can find in the supermarket, but not for the raw materials that are used by different bakeries to produce their own bread, for example. And it is really important to note that the interpretation of the language was varying because there were some manufacturers of raw materials that interpreted that they needed to reformulate their products. So in Argentina, we have some manufacturers of raw materials that have made the reformulation and some others that not. So it depends on which is the manufacturer that you buy the raw materials that you're going to find products that are complying the regulation or not. And it is also really important to note that even though the phrasing of the regulation is really similar to the Danish law, in Argentina, it was interpreted really different, because in the Danish law, it covers raw materials, even when it is written in the same way. And as we're going to see in the next slide, the National Food Commission, that is the CONAL, is in charge of issuing regulations, and it is now trying to fix the issue with a new regulation and a change in the language of the regulation. So the next slide, please. As we can see here, the numbers are really high when we talk about compliance in Argentina. It has shown a lot of success, but it is really important to note here that the way in which the monitoring and the enforcement has been designed is not providing the complete picture, because some products are not being checked. So the agencies that are responsible for monitoring in Argentina are only analyzing the packaged fruits products that are intended for direct consumption. And there might be some products that are high in TFA that, due to this loophole that there is in the regulation, they are not being captured in this data that we are showing now regarding the compliance. So the next slide, please. And as I was saying, there are some unpackaged foods that are not being monitored, such as foods that are sold in restaurants, foods that are sold in bakeries, and other foods that are not prepackaged. So this, and I say it again because I know that it is a little bit difficult to understand, but so there are some fats and oils that are intended for use for bakeries and for restaurants that are not being monitored. And so not all of these manufacturers have reformulated their products. And so that you can have an idea, in Argentina, according to the Ministry of Finance, there are 33,000 bakeries that bake their own products. And it depends on which manufacturer they buy the raw materials that they are going to have or not a product that is high or not in TFA. And according to our sources that we have at the Ministry of Health in Argentina, there are 13 producers of margarines, shortenings, oils, all raw materials. And these 13 producers include a mix of large and small producers. Overall, these producers, there are 2 companies that have reformulated their products. So there are 2 companies over 13 that reformulated their products, and these cover approximately 45% of the market. And so therefore, and taking into account these numbers, there is an estimation that approximately 65% of the unpackaged foods that use those raw materials are not complying with the TFA limit. So due to the interpretation that I was telling you of this regulation, there are some unpackaged foods that use raw materials that are not reformulated and that potentially have TFA levels that are exceeding what it is established in the regulation. So the next slide, please. As I was telling you at the beginning, last year, the National Food Commission started to propose a modification to the regulation. Within the Ministry of Health, they realized about this loophole that the regulation had, and that this regulation was not applying to all the raw materials. And so they proposed this modification to broaden the policy so that it's not limited to final products that are directed to consumers. What they are doing is to include specifically in the text of the regulation, as you can see in the slide, it is going to say including ingredients and raw materials. Something that we can mention here is that maybe this language that they use is not recommended. Maybe another solution would have been to say, to not say for direct consumption, and that would have closed and also the loophole. But this was the decision that the National Commission of Food in Argentina took. As for now, they ended a public consultation, and they are now in the administrative process of evaluating all the opinions that they received to this draft regulation that they have. And there have been no results published yet. The next slide, please. So as key takeaways from what happened in Argentina, and as I was saying at the beginning, Argentina was really a pioneer country in establishing the mandatory TFA limits. There were studies that were published that really noted that this regulation would avert anywhere from 301 to 1,517 cardiac deaths annually. And this local study showed that the regulation would have a substantial positive impact on the general health of consumers. But well, it's also really important to note that this projection was not taking into account this loophole that the National Commission of Food has noted now, and that is now attempting to amend to improve the effectiveness and to broaden the policy to all the other products that are being sold in bakeries, restaurants, etc. So it is really important that by learning from Argentina's experience, other countries can design this effective and comprehensive TFA measure that take into account the whole universe of products and that do not leave any product aside. And the next slide, please. What we would like to now make is a little bit of the conclusions of the whole webinar, in which it is really important to first effectively regulate TFA after analyzing the country's regulatory system, and also after this global analysis, legal analysis that takes into account what happened in other countries, what can be improved from other countries, and also to analyze how is the food supply chain in each country so as to regulate accordingly. It is also really important to review the existing TFA policies, such as labeling requirements. And for this, I would like to show you an example from Argentina. According to civil societies organizations in Argentina, TFA labeling is not always reliable. And so this is a factor that should be considered when designing and monitoring TFA limit. It is also really essential to ensure that implementation, monitoring, and enforcement are accounted for early in the process design, in the policy design process, so that really appropriate mechanisms are built into the TFA measure. And for this, an example is also what happened in Argentina. In Argentina, the loophole demonstrated why the enforcement at every stage of the supply chain should be accounted for the development of the TFA measure. Then it is really important to clearly define all key terms and carefully draft the TFA measure to avoid any potential misinterpretation. And for this, Argentina is again a great example to show that it is really important to define all the products that are going to be under the regulation, and so as to avoid any possible misinterpretation by the monitoring agency. And finally, what I was telling you at the beginning of the presentation for Argentina is that even though the industry can play a really important role in the development of a TFA regulation, it is also really important to establish safeguards against the conflict of interest, both for the TFA policy and also for the development of any other nutrition policies that could come in the future in which the industry might be interested to participate. And so thank you very much, and we are really willing to hear your opinions and questions if you have.
Thank you very much, Yolanda, Kira, and Gianella, for that very clear and helpful presentation of the various considerations and implications of trans fat elimination policymaking. I think that was a really, really great presentation. So we'll now open up for Q&A. We have about 15 minutes left for this session, and as a reminder, we encourage participants to use the Q&A button to ask questions, and that button is located at the bottom of your screen. Participants will now be unmuted, and also this webinar is being recorded and will be posted on linkscommunity.org, so you can reference all of this great discussion at a later time. So the first question is, WHO has called on countries to eliminate trans fat from food in the next 5 years by 2023. Is there any plan, mechanism to support WHO regional offices to develop legal and policy framework for regulating trans fat? Maybe I can answer that. Yes, so Resolve to Save Lives, as a part of our partnership with WHO, we are working with the regional offices and specifically the Pan American Health Organization, PAHO, does have a regional initiative that is active, and they're currently working with the member states on that. We're also, as we've seen some progress through trade blocs, for example, the European Union just enacted regulations in April to follow the Denmark model, so one of the 2 best practice models in WHO's Replace Action Package. So we'll also be working with WHO to explore how we could leverage these existing trade blocs to eliminate trans fats as well. The next question is knowledge of health impacts of TFA among consumers, media, and politicians is poor. We don't have any baseline data for trans fat sources, but the Federal Ministry of Health has now purchased the equipment for measurement of TFA. The poor knowledge and understanding of food and health issues by consumers, together with low literacy rates in my country, in Nigeria, what will be the best strategy for enforcing regulation? Maybe Kira, you want to take that?
Absolutely. So in terms of the knowledge of health impacts of TFA among consumers, and in regard to media attention, that's something that at the Incubator, we have strategies to raise awareness with those in the media to be able to bring this issue to the attention of the public and to policymakers and other stakeholders. In regard to baseline data, this is something where it can always be helpful to see what different government agencies may have already developed, or data from different sources that you can leverage that gives you some sense of whether there is trans fat in the food supply or for what products. But if there is no data like that available, then there are ways to design studies that can be quite brief in terms of the timeline, that can give you an initial starting point to know that there is indeed trans fat in the food supply and some of the main places where, the types of products where such foods exist. And in terms of, was the second part of the question about setting up enforcement capacities?
Yes, it was.
So in terms of then looking at enforcement capacities, one thing to do is see what types of systems are already in place. So for example, for Thailand, we can think about how when it came to imports, they were able to use a system that was already in place, a certification system, and then apply that to their PHO ban. So I think it's always helpful to first analyze what's currently available, build from that, and then think through what levels of the food supply chain you may need to monitor and enforce, and then account for those in how you design your regulation. So it will be different for each country, but it's something that some analysis of what already exists can really help inform as you look to move forward.
Thank you. The next question is, who, if anyone from your organization, was heavily involved in the TFA ban in the US?
So we were not involved in the PHO ban in the US, but one thing we have done is we've talked to different people who work in the US government and have worked on these issues to learn lessons from them and to understand more about their approach.
The next question is, where is the beginning point to start TFA elimination in low-income countries like Nepal, where there is no concrete policy, rules, and regulation?
So I think by looking at what's been done in other countries and some of these lessons that we've learned, I think that can be a helpful starting point for any country that's looking to pursue trans fat regulation now. Denmark was the first country to do this, and we know that they had a lot of evidence that they built up. And different countries will have different levels of information about trans fat in the food supply, different regulatory systems. But thankfully, since Denmark, we've seen now a whole host of other countries start to design these policies. And so we can use that information from the global community to think through what might work in different countries now, and also to do that legal analysis and the other types of scopings, like a scoping of stakeholders and the policymaking process, which for each country then can help you design a measure that's specific to that country's regulatory system and food supply chain.
The next question is, what role do you think the industry can play in developing national TFA policy while ensuring there are no conflicts of interest?
So I can start, and then maybe Janella, you might have some information from Argentina as a specific example that you can chime in with. But in terms of industry, they can be helpful in identifying healthy replacements for trans fat. But then it really is a question of, what are the industries at play in each country, and are there very strong industries like, let's say, palm oil is one industry that we've heard about as being potentially problematic or challenging in a lot of countries. And so it kind of depends on having a sense of the different types of oils and the different industries that are in each country in the type of role that they might play. But I'll turn it to Janelle if she has anything she wants to add.
Yes. Well, in Argentina, what happened was that, and maybe this is the situation for other countries, the industry had the information. So they were the ones that had the information, how to reformulate, as Kira was saying, the data. And for the Ministry of Health on their own, they couldn't have done it without the help of the industry to know how they could reformulate, which was the best alternative. I think it is a really specific issue for TFA, and so there was a need to collaborate with the industry. The problem comes when there are other nutrition policies that, for example, to regulate, for obesity prevention, to regulate marketing of unhealthy foods, in which now the industry that is happening in Argentina want to be seated at the table for regulation of the marketing of unhealthy food, or, for example, to regulate front of package nutrition labelings. And so those are different policies in which, for those, it's really important to establish those safeguards of conflict of interest, because they could possibly participate in a public consultation in which they say which their opinion is. But then to be stated when defining the policy, it is really a different topic than what it was with the TFA. Because for the TFA regulation, they were the ones that had the information on how to reformulate and the data. And that data was needed by the Ministry of Health. Maybe in other countries it is different, but in Argentina, that was the situation.
Great. The next question is around the role of local and community level organizations and how they can aid government and other actors to achieve policy change around TFAs and PHOs.
So groups on the ground in every country are really instrumental to moving policies forward. They will have a sense of who key political actors are, what's important for their populations. And so really by identifying the strengths and the needs of local organizations and then meeting them where they're at, that's, I think, really an essential building block for moving forward with the trans fat policy in any context.
Thank you. And I'm going to apologize in advance. We have a lot of questions, so we won't make it to all of them. So apologies if your question doesn't get answered on this session. The next question is, do you have any experience or examples of policy considerations for countries which have a lot of street food, particularly street fried food, where it's difficult to track the type of oil used?
Yeah, so this is one type of consideration where we think it can be really helpful to identify different aspects of the food supply chain. So if you have a sense that you know that there are a few key oil producers and you can trace the way that oil moves through the food supply chain, then you can target the top of the food supply chain. But there are plenty of circumstances where there might be informal markets and you won't be able to have that ability to trace the oils with such certainty, or other foods high in trans fat. And so in those circumstances, having a 2% limit might be a good fit because it allows you to target more levels of the food supply chain. Of course, you always want to kind of move as high up the food supply chain as possible, just because in terms of the regulatory burden, it can be less because you're dealing with fewer actors, and also you're going after kind of the larger actors. But still, you can design a policy so that if you're identifying trans fat lower in the food supply chain, you can monitor and enforce at a lower level. And enforcement can involve things like trying to gather information about where oils are coming from.
Great. The next question is about availability of baseline data, and in situations where this baseline data is not available, how can the policy still be drafted, sort of minimizing the availability of data?
Well, one thing that can be done is there can be some sort of sampling of products that can be put together quite quickly and efficiently to try to build up at least some initial information, really, so you can at least say, we see that there are some products that have trans fat in the food supply. So I think seeking information from partners or others doing this work to find some guidance on how to put together kind of a quick product sampling study can be a really helpful starting point. And also, just contacting different ministries of health or food and drug safety for national food consumption tables could help you find some information. Of course, in some circumstances that won't work, you won't find what you're looking for there. But I think by just reaching out to different ministries and agencies, you can see if there's anything that can provide some sort of starting point. And then when you design your measure, you can make sure that there are really strong monitoring mechanisms put in place. And that can help you then build up that database of information moving forward. So even if you didn't have too much information to start with, the monitoring and enforcement can help you build up that information.
Thanks, Kira. Thank you everyone for participating in the webinar, and a special thank you again to our presenters, Yolanda, Kira, and Janella. I want to announce that the next LINCS webinar will be on Thursday, July 25th at the same time, 9 a.m. to 10 a.m. Eastern Time. The topic will be blood pressure device selection in low and middle income countries, presented by Dr. Raj Padwal, Professor of Medicine and Director of Hypertension Dyslipidemia Clinic at the University of Alberta. As always, the webinar will be recorded and made available to the LINCS website following the session. Thanks again.